Okay, hi, my name is Victoria Ackerman, and I'm doing the last part of the disease presentation. So let's get started. I'm going to be talking about transmission. I used two different sources for my presentation. I got most of my information from the CDC website. I highly recommend you go there and read about typhoid fever. And I also got some of my information from the Mayo Clinic website. Both are great sources, and I highly recommend looking up information if you are curious about either site. Typhoid fever is a life-threatening disease caused by the bacterium Salmonella typhi. It remains a serious health threat in the developing world, especially for children. People are the only source of this disease. There is not the same type of bacteria that can cause Salmonella food poisoning, but the two are related. Salmonella partai is a related bacterium that usually causes a less severe illness. Persons with typhoid fever carry the bacterium in their bloodstream and intestinal tract. In addition, a small number of persons called carriers recover from the typhoid fever but continue to carry the bacteria in their stool, often for years even after treatment. You can get typhoid fever if you eat food or drink beverages that have been handled by a person who is shedding Salmonella typhi, or if sewage contaminated with Salmonella typhi bacteria get into the water you use for drinking or washing food. The CDC recommends either cooking your food or boiling it, eating nothing raw. Also, they tell travelers to never eat anything from street vendors and to always peel your own fruit after washing your hands. Never eat anything that has already been peeled. Typhoid fever is more common in the areas of the world where hand washing is less frequent and the water is likely to be contaminated with sewage. The majority of people in industrial-sized countries pick up typhoid bacteria while traveling and spread it to others through the fecal-oral route. You can contact the infection if you eat food handled by someone with typhoid fever who hasn't washed carefully after using the toilet. Once Salmonella typhi bacteria are eaten or drunk, they multiply and spread into the bloodstream. The body reacts with fever and other signs and symptoms. Okay, now let's talk about treatment, prevention, and control. Typhoid fever can be prevented and can usually be treated with antibiotics. Most people with typhoid fever feel better within a few days of starting antibiotic treatment, although a small number of them may die of complications. If you're planning to travel outside the United States, you should know about typhoid fever and what steps you can take to protect yourself. Two basic actions can protect you from typhoid fever. The first is avoiding risky foods and drink, and the second are getting typhoid fever. There are two types of vaccines in the United States. Vaccines usually are reserved for those who may be exposed to disease or are traveling to areas where typhoid fever is common. Each vaccine needs to be taken at least 1 to 2 weeks before going on a trip. The vaccine can last for years. Vaccines against typhoid fever are available, but they are only partially effective if you've been vaccinated but they're only partially effective. If you've been vaccinated, you need to ask your doctor for a booster. The first vaccine is TY21A. It is an artificial immunity, which means the protection from infection obtained through medical procedures. It is one capsule that can be taken orally. You need to take it 4 times a day for 2 days, 1 week prior to the trip. This vaccine can last for 6 years. It does need a booster every 5 years. The second vaccine is VICPS. It is also an artificial immunity. It is an injection, but you only need to take one. It has been given 2 weeks prior to the trip. It can last for 2 years and it needs a booster every 2 years. In the United States, it's estimated that approximately 5,700 cases occur annually. Most cases, up to 75%, are acquired while traveling internationally. Typhoid fever is still common in the developing world, where it affects about 21.5 million persons each year. So please be safe while traveling. Be sure to get the proper vaccinations before traveling internationally, and bring your own drinking water or buy bottled water. Thank you for watching.